like, bitch, what am I supposed to study? Well, guess what? The test plan gave you a study guide, and y'all don't know none of this. When I talk to my beautiful babies on the phone and I say, go get your CPR report. First, I can't find the shit. They take a whole hour. I say, call me back, because you ain't ready. They go, they find it. I say, okay, let's go over it together. And we go over it together. And I literally ask them, and they blow my fucking mind every time I do it. I say, okay, what is management of care to you? Because if you don't know what it is, that could explain why 20% of your test is gone and failed. Okay? So they say things like, oh, that's where you take care of the patient. Fuck, no, it ain't. This is not where you take care of no fucking patient. This ain't got shit to do with no fucking patients. This is all management, bossy stuff. This is all the boss, okay? Make assignments, delegate, your advanced directives, consent forms. That's what that is. So if you thought that was direct care of the patient, we already starting off wrong, because 20% of your test was fucked up from the jump. This is my favorite. This one right here, my favorite. Because your test, the people who wrote the test is so annoying. The little bullshit that they put on here is bullshit. So I'm going to tell you what each of these mean. You don't have to write it. I gave you a sheet for it. You good, y'all. You good. I got you. But my favorite is to ask you this. And don't turn your little pages. Health promotion and maintenance. Sounds like a bunch of gobbledy fucking gook. So what does it mean? Just give me 2 words that you think it means, and we're going to keep it moving. What do you think it means? Couple words. Don't matter. Whatever you say is cool. You would think. That's what the fuck I would think. What you think, baby?
Diet control.
Diets? Okay, that sounds good, because, I mean, it makes sense. You'd be surprised. Makes sense, because, again, you and I did go to school. Everything y'all said makes sense, but this stupid test is on some trash. Preventative stuff.
I was going to say lifestyle change.
Yeah. Sounds like it would.
Preventative care.
Preventative. ADLs. Exactly.
Disease prevention.
Prevention.
That and just educating.
Educate. You would think.
Oh.
You would think
Oh.
that. You would think that. I mean, it just, they fuck with you.
Pretty much the same post I was thinking effectiveness of like stuff.
Effectiveness of stuff. I'm gonna need you to work harder.
Like if it's working or not, basically.
Okay, so whatever you're doing, is it working for you? Okay.
Promoting health.
Just promoting health. I mean, you would think it, I swear to God, when you find out what it really means, you're gonna shit your pants.
Yeah, I was thinking like health advice.
Hello.
Like lifestyle changes.
I agree with prevention.
Guess what the fuck this bullshit means? Maternity, pediatrics, geriatrics, cancer screenings, and fucking vaccines. Does that look like it means that? No! This is why people fail. It's so annoying. It's so annoying. Why can't they just say that on here? No, they don't say it on here. When you read this, listen to this bullshit. Okay, y'all ready? Provides nursing care for clients that incorporates the knowledge of expected stages of growth and development, as well as prevention and early detection of health problems. The fuck? No. Keep it simple. Maternity, peds, growth and development, which was the only thing they put in here, and your geriatrics, your cancer screenings, and your vaccines. But they didn't say that, so you didn't know to study that. So consequently, we have 1 million people that tell me, I can't believe how much maternity was on my test. Like, what the fuck? They just killed me with maternity. I bet they did, because once you missed a couple, they kept giving you a couple more, because it's called adaptive testing. Right, y'all? They just tore that ass up with it. This is what they do. Okay, does it make sense? Is it starting to make a little bit more sense now? Okay. Now, so when you look, baby, I ain't forgot, I'm gonna give you that back. when you look on page 24, and you see that the last thing that you do, and it literally says lastly, okay? It says lastly, do U-World questions in clients' needs. So you'll see when you set up your U-World, they got two little options. They got subjects and then they have clients' needs. This is right before you start testing, the real test, your real NCLEX exam. Right before you do all that, this is the last part. Okay, so what you're doing is you're pulling this up, and in this brother's case, he did pretty decent. He did not like psych. We said psych can be very hard. So he would look at this section, and you see all the different subjects, and you see that psychosocial integrity, and you see safety and infection control. I highlighted those as big focus areas of the test. And there you go. He would do more questions in those than anything else, because he knows on his CPR report, he didn't do that great in psych. He would take out of all of these that you do questions in and you look at the videos for, he would really go right back to the original game plan and look at more psych. Does that help a little bit? It's all based on what was your weakness area. You've already strengthened your knowledge so that they give you basic and then make it more difficult. You've done that part. Now you need to look at what you didn't do well last time, kind of do a little bit better and really kind of focus in that area, but don't sleep on the rest. That's why this is last. Now, so what people have done in the past, I'll tell you mistakes that have been made. They look at this paper and they say, oh, well, I got aboves in this, that, and the other, and I got almost all nears and everything else, but I got a couple belows. For the next test in 45 days, which is your first problem, because nobody should take a fucking test 45 days after failing the first one. No one. For your second, this is what people do. I'm telling you what they do. For your next test, you say to yourself, oh, well, then that means all I have to do is study this one that I got the below in, and I should be ready to roll. Then you get on that test and they give you one question in what you failed in, and you never see that subject again. And you're like, well, goddamn, I thought that you wanted me to study that, work on that, do good in that. Now you're giving me all this other stuff that kind of was like, I didn't look at. Because 45 days comes by real fast. 45 days is just 6 weeks. When people repeat their test in 45 days, 99.99.99.99.99% of them fail it. Unless there was some outstanding thing that happened, like a death in the family, or you had a baby, you were pregnant and sick at the test, you had an outright panic attack at the test. Unless there was something weird like that happened, you generally will fail it 45 days later. It's just not enough time to do what you're supposed to do, especially if this didn't have all aboves on it. So like I said, the one girl brought that damn paper in here with all aboves and one near and failed. So yeah, she can do 45 days probably and get by with it. You can't with all these nears and the belows here and there. No, baby. You got to pump your brakes and do this right. Okay? Now, so you got it. You see all the little things at the bottom here. They are the last thing. Do you have to master in it? No. That does not require what score, RN? 85. What score, LPN? 75. It does not require that score in these subjects. Is that good? Y'all all right? Now you know what you're doing. You should just leave it the fuck up out of here. You know what to do. Okay, now let's go to the test plan. If you go backwards 1 page, you will see the test plan. I did put it on the board because I wanted you to know the percents. The 20% is management of care. If you're an LPN, what will this say? Coordination of care. It's the same thing. It's the exact same thing, right? And so if you look on page 23 and you see the management of care, you see right there, not direct patient care. Y'all see it? That's what I would highlight if I was y'all. I would highlight that because you need to know this. These questions ain't gonna have nothing to do with the patient too much. They are, however, prioritization patients. So what we like to tell you, the prioritization of patients, is we like to tell you that those questions are probably the most practical questions you're ever going to get, because when you get out in the real world, you're going to have to prioritize. You're going to come out on the floor, you're going to get report on your patients. If you work on the best unit, I consider the best unit in the whole hospital. One of my babies is here today from that unit. I worked on that unit. I send you to that unit so that you can learn all the basics in one floor. If you go to that floor, we'll pretend like you're going to go work on the unit that is the best at the clinic, and you go to H81. You get report on your 5 or 6 patients. I already told you guys, and I'm going to say it again because I need you to have some balls. I need you to find your cojones, because you're going to have to go up against management every now and then, but you're going to be brave because they need you, not the other way around. When you get on the unit and they try to give you on a hospital, I ain't talking about nursing home because that's a whole nother ballgame. When you work on the unit and they try to give you 7 patients on a hospital floor, don't take that assignment. Don't even take report. Because what's the rule? Once you take report, you're responsible. Do not. You say it with the firmness. Oh no, this is an unsafe assignment for me. I don't feel like my patients will get the safe care that they need. I can't do 7 patients. So I'm gonna need you to tell me which of the 6 you want me to take. And you say it just like I said it. And you're going to face a lot of flack. So what? They ain't getting rid of you, baby. You just went through orientation. You just went through all your little, preceptor, whatever it was. They spent money to train you. They ain't finna fire you because a new grad said they can't handle 7. They're actually probably going to be pretty proud of you because, oh, she know what she can handle. She's smarter than this one. I gave her 7, she didn't say shit. And you got a lot of people that won't say nothing because they're scared. See, I keep showing nurses, if I'm known for anything, I'm known for telling you to know your power. You have a hospital full of power and they don't use it. So during COVID, when they said, we need you to put your mask in a bag, I said, oh, no, the fuck, I will not be doing that. Oh, no, I got a little news flash for you. I teach this shit, okay? This is what I do. So for you to tell me to put my mask in a bag is the nastiest shit I ever heard, number 1. Number 2, I ain't heard you tell none of these doctors the same thing, and my life is no less valuable than a doctor.
What you mean a bag?
They used to tell you to put your mask. Who remembers? Raise your hand. See, you got a bunch of people. They used to tell you to put your damn mask that you done wore all damn day in a paper bag for tomorrow.
Use it again the next
Right.
Trifling. Nasty. I said, oh, the devil is a lie. I ain't doing that. And another thing, when I get done with my lunch, I want a new mask because I know my rights. Okay? So, no. Power. Use your power. They need you before you need them. It's a nurse's job around the corner. Don't get caught up. Okay, now, so what you're going to do is when they say you got 7, you ain't doing that shit. But you got 6, you got 5. It's like, oh, fuck, okay, whatever. Now, before there was even any COVID, when nursing was normal, you had 4 to 1. Now, 6 to 1. Whatever. It is what it is. But 7 to 1 is some bullshit. So you got your 6 to 1. All right. Now, I will tell you this right up front. Before you leave today, you will know exactly which one of them to see first in your 6 people, because we go over which ones are highest priority. So organizing your day is critical. We can always say if there's nobody doing nothing cray-cray and ain't nobody dying and you checked and did rounds and ain't nobody dead, then always see them damn diabetics first. Because your diabetics will throw you a curveball. They are the hardest patients. When they get into trouble, it's trouble, and it's deadly trouble. So just kind of look at them first. Eyeball them little babies first, okay? So when we do prioritization, you will see me talk about which ones are highest priority. But if none of that is on your list of your 6, then make the diabetics your priority. Okay? Now, you'll see what I mean in a little bit. Now, if we look at number 1, this is all the stuff that is, I would say, very confusing to you if you went to LPN school, because LPN school does not do a good job of management of care. Because first of all, they're calling it coordination of care. And what I have seen with LPN programs, they don't teach you to delegate. Matter of fact, they act like you're never gonna have to. But that's bullshit, because you are delegating to the what? UAPs all day, more than even the RNs if you work in long-term care. As a matter of fact, and I mean this from the bottom of my heart because I've done all of it. If you are an LPN, you actually are going to end up having to know more. Let me explain. As an RN working on a hospital floor, a very popular hospital floor, I got a little baby here from that floor today. As an RN working on that floor, I had assistant nurse managers on the unit at the time I'm working. I had residents on the floor at the time I'm working. I had a bunch of other RNs on the floor at the time I'm working. Now let's talk about you LPNs. You're working a weekend. It's Sunday. Matter of fact, it's motherfucking Super Bowl Sunday. You done had 10 call-offs. You have 32 patients. There's not a doctor around at all ever anyway, much less Super Bowl Sunday. Ain't no A&Ms just floating by all day long for you to grab. The RN that you might have in the building is dumber than you ever will be because you taught her ass. That's just real talk. Okay, so there you are with 32 patients that could do anything at any time. And you're only you. You got to figure that out. So I'm sorry. I think you have to be smarter and think harder and faster than the average Jill or Joe at the hospital who has rapid responses they could call, AMEDs, people all around them on the floor, all around them. No, don't get it twisted. When you leave up out of here, this shit is hard as fuck. For the LPN, it's really hard because you don't have like good resources. So be careful where you go work, LPN, because I know when you go work at a hospital, they don't pay as well. I get that, but that might be where the fuck you need to go so that you don't lose your license before you barely got it. And then once you get your knowledge up under you, you can go on and kick it at a nursing home or assisted living on the weekend and get your money up a little bit, get some property up under you, get some real estate. I could go on and on because I don't believe in working for nobody but me, but that's another class. But what I'm saying to you LPNs, if you're smart, you will get a job at a hospital first. Get your basics down. No, they don't pay as well. So keep your PRN or part-time gig on the side. And then you can do whatever the hell you want to do. Because you are going to be very sad, very mad, very upset, very frustrated when you realize that all you are doing is glorified dope dealing. And you ain't doing that too well because ain't nobody get a breathing treatment today and ain't no motherfucker in here getting their wound care. That's real talk. That's just what I see all day long. Okay? All right? So that's what that is. You LPNs have the hardest time with management, or in your case, coordination of care, because the schools are not teaching you how to delegate. So we're going to be teaching you that today, and you will know it well. This safety and infection control, my God, look at that board over there. That board over there, we call that infectious disease gumbo soup. It's got all the infectious disease. Before you leave up out of here, you will have a pink packet with all those infectious diseases. And those infectious diseases, mostly on your test, really focus on the precautions. So before you leave this weekend, your ass will know contact, droplet, airborne, standard. You will know all of those and understand them completely. And then they're going to ask you, well, what do you wear to go in the room, right? What do you wear for the patient to come out the room? You know, PPE type shit, and what order do you put it on in, and all this other kind of mess. What antibiotic do you need to treat it? And what's the vaccine if there is one? And what's the allergies to check if you need a vaccine? That is that. Don't sleep on infectious disease. Okay, so that's this. 15%. So if you look at my little board here, peep this. 20% is the highest. And I put these wavy lines because it's about. About means they could go 12 to 15, 18 to 21, 12 to 15. It's about, right? So you got 20% here, you got 15% there, you got some pharmacology that's up here, but then the ones that's little is sometimes the ones that's gonna fuck you up. This one right here is the worst. It used to be number one before the new test. Once they came out with the whole case studies and whatnot, these two are a tie. So it's a lot here if you don't know any of it. If you know it, you'll never have to worry. So what I teach you today, you are going to be good as long as you make your flashcards off those diseases that I'm going to give you in the list. And I'll show you, for example, what I mean about a flashcard. Let's see where I put the date on. Oh, here it is. So if you look on that board, you maybe can't see it, but I made a flashcard for impetigo. It's on the left side at the bottom. It's written kind of up sideways. And so I made a flashcard for impetigo. When you make your flashcard, and we'll go over this again, so don't worry, don't even write it down because I'm gonna go over it again. You write down your precautions for that disease and who gets it, right? Like preschoolers, and what's it look like, that sort of thing. But you don't write a lot because you can't remember a lot. So some of you who do flashcards, I've seen a few people with the flashcards. I got this itty bitty writing and the whole motherfucker is filled and looks like crazy. No, just big words, big words. Caused by strep, honey-colored crusted pustules, no vaccine. Complication, rheumatic fever. Okay, glomerulonephritis, that sort of thing. So we kind of teach you how to make that. What do you do? How do you make the flashcards? You cannot make flashcards for everything. Only infectious diseases and the meds I'm going to tell you. Okay, so flashcards for everything else is stupid. It's crazy. It's horrible. Okay, now look at the health promotion. Here in this pink, oh my God, packet, we give you some quickies. So I'm going to give you a maternity and pediatric quickie. I'm going to show you some of these things where you're like, oh, okay, that's cool. I know that. So it's not that bad. And you don't have to master in this. You just have to be aware of this whole maternity, peds, whatever. Now, psych, I already told you about psych, but look at what else psych is, y'all. It's also cultures, religion, and therapeutic communication. So in this packet, the most common culture and religion questions, they're already in here. I got you covered. I got you. Okay, so that's not a big deal. Number 5, basic care and comfort. This whole packet and this one, this oh my God packet has a shitload of basic care and comfort in it. And of course, this one that'll be pink. They're white up here because I copied them onto pink paper. But this one, these two together are all the basic care and comfort, reduction of risk, because this and this overlap so much that you will need the videos, fill in the rest. This guy failed 18 times on this issue. He couldn't believe what he was doing, he said before he watched my video, is he was picking medications. You may not know that you don't want to pick medications on this test. No. So when I talked to him, I said, okay, let's do a little basic care and comfort together, just so you know what the fuck is basic care and comfort. I said, if I tell you that I'm constipated and you say, okay, let me get you a stool softener, you just failed. What were you supposed to say? Push fluids. What else, y'all? High fiber diet. What else? Walking and exercise. Now look, All of that is already in here, right? It's in here. It's damn sure in the procedures packet, but mostly it's just in here. So what you're showing, because basic care and comfort is this, what you're showing when you pass this question is nurse teaching or patient education. That's what you just did. All three of that was patient education. Diets and nutrition, because you said high fiber, somebody up in here. And then you said walk, ambulate. That's ADLs. Y'all feeling me on this? That's what the fuck that is. That's what that is. But here's our problem as nursing students. Every single one of you, it's not your fault. If you spent 4 years in school, usually you don't have this issue. But most of us don't. I did, and I learned all this first and second year. We did all this at Ursuline, both first and second year. But if you went to school for 2 years, 10 months, whatever you did, this was not their priority, because guess what? They were thinking about all of these disease processes, that they didn't cover the fluff. The test likes the fluff. The test prefers the fluff, because you're a nursing student. You're not medical student. So they concentrated on signs and symptoms and, treatments and meds for all this here shit. They didn't really tell you that the test is more interested in what do you do as a nurse that nobody else at the job is going to do. See, that's what this is all about. What do you do at work that no one else is going to do? You can't say that you give the patient meds, because that's called a pharmacist or a doctor. They not looking at you now. You done say get a patient the med. They like, oh, she on some bullshit. She don't know how to be a nurse. She's going to give her patient so much medicine. She's going to call for a stool softener order. Now we can add to his 42 meds a 43rd, which is always dangerous. You don't need to be taking all them damn meds. We're the only country in the world that take all these fucking meds. Everybody in the world thinks this is crazy what we're doing. The average number of meds in Europe for old people 60 and up is 2. Here, it's 11. Just 11 meds, just because your ass is old. That's crazy. So no, don't do this. Here's another one. You told the patient, your patient told you they're having heartburn. If you went and got them a PPI like Nexium, you failed basic care and comfort, didn't y'all? What was we supposed to tell them? Don't lay down after eating. Remember that? Don't wear tight clothes. Stop eating so much fried food and acidic foods like lemons, oranges, grapefruits. Don't do that either. Anything with acid. Tomatoes the worst. Diets and nutrition. Patient teaching. Tell the patient, number one way to get rid of heartburn, lose weight. So this is all the stuff that you do, and you probably don't even think about that you do with your family even, because you remember, don't you, that the first year, really the first month you got in nursing school, your whole family thought you was a doctor. Mm-hmm. They called you about the cat. They called you about their baby. They called you about their man. Because all of a sudden you're the resident expert, So you probably do it with mama and them already, but your test wants to see you do it on a test, okay? You already told mama quit all that eating that crazy stuff. You told her already. Okay, so that's what we're saying with basic care and comfort. It's what do you do that no one else does, and how do you do it without meds? Now, it is also, if you look on here, pain management. So this is a little different because, well, Shelly, how do you do pain management without meds? Well, actually, this, please write it, is over the counters. OTC. What's OTC? Over-the-counter meds. The boards of nursing throughout this country have given you the responsibility to know your over-the-counter meds. So they want to see if you understand that a lidocaine patch would help with arthritis. That's basic care and comfort. They want to see if you know Voltaren, which is the brand name, diclofenac, which is the generic name, cream will make any painful joint stop hurting. They want to see if you know that, okay? They want to see if you understand that over-the-counter NSAID should be taken with food, right? And you don't want to give them to every Tom, Dick, Harry, Sue, Jane, and Mary because they have their risk, okay? So they want to see if you know how to do a pain scale for a child. Do you understand the pain scale and what numbers on the pain scale are significant enough for you to act or do nothing? They want to see if you understand that relieving pain is not just about meds. It's about position changes in bed. It's about change the linen in the bed. It's about a bed bath. It's about the fact that the patient maybe just needs to just sit up. They've been in the same slouch spot for God knows how long. They want to see if you understand that spending time, you don't have it, but your test says you do. Spending 5 minutes of time at the bedside just talking to the patient can alleviate some of this pain. They want to see if you get that. So we have a whole page on how do you relieve pain, from cool packs to warm packs to massages and all the crazy stuff they got for you to relieve pain. Of course, you ain't rubbing nobody on this test but your man. So you just make sure you don't rub people, but know that that is available for people to schedule. You just ain't doing it outside of this hospitalization that they're suffering with right now. TENS units. There's lots of things. Biofeedback. Breathing, deep breathing and relaxation technique. That's basic care and comfort. Okay, so it's kind of big, y'all. Pharm and parenteral therapies. Let me tell you about this. First of all, do your girl a favor. Please don't study no damn math. Please don't. That shit is not on your test. And even when it is, it can make or break you, fail or help you. So don't study math. Now, I say that because if you're like me, and I'm terrible, I failed math at Ursula, and I'll never forget that shit. I am terrible in math. And even when I think I got it right, I'm suspect, okay? So I'm too nervous and anxious with math questions. I mean, you give me one now, I'll probably throw up. I don't do it. And I've been a nurse 40 fucking years. I have not done math yet at work. Can I keep it real? So the bullshit your school put you through, where they tortured you for semester after semester after semester with all this math, nursing schools everywhere, stop it. They did not need to do that because, number one, think it through. What hospital is going to trust your crazy ass to do a math question with a real live patient? None of them. Not one. So now they done got to the point where everything is based on dose for the patient. You ain't got to calculate shit. Your pharmacy sends the dose that the patient needs, and that's the end of that. Quit tripping on it. Okay? So don't study math. Please don't. Ain't nobody out here relying on y'all to do math. Everybody be dead. Shit. Okay? You just too stressed. You got too much going on at the hospital as a nurse. Math? I wish a Mickey Ficky would. So don't do it. Now, the problem is, after you pass your test and you get that new job, that motherfucker gonna give you a math question. They gonna give you a math test. So right after you pass, go back in your U world and study every math in there for your new job, because you know we ain't doing that shit for no test. Your job will give you an EKG and a math test. I prepare you for the EKG all day, and it's so easy the way I teach it. But math, shit, don't look at me. I don't know the shit either. Okay, people, I did you tutor math? I wish I would. No, baby, I don't even know it myself. Okay, so don't study math, all right? Now, remember this. All the medications are generic, which is a pain in your ass, but that is what it is. So if you thought Lasix was on your test, think again. It ain't. It's not. It's never gonna be. If you thought K-Exalate was on your test, no, it ain't. No, honey, you're gonna get that polystyrene crap, okay? So, yeah, it's all generic. We're gonna go there with you. You're gonna be fine. When you leave up out of here, you feel really good about meds. Number 7, reduction of risk potential. These are all your procedures. You're going to get a pink packet, and that pink packet is so valuable. It's going to have crutches, canes, walkers, NGs, Foleys, endoscopies, colonoscopies, MRI, CAT scan, blood sugars, ventilators, incentive spirometer, Allen's test, anesthesia, analgesia, blood transfusions. Oh my God, the whole damn packet has, I don't know, over 1,000 procedures. You will have everything you need in that packet to seal the deal on one of the highest failed areas on the test. So I got you. So don't worry about that. Okay. Now, part of reduction of risk are your precautions. They're in your Oh My God packet. We're going to be covering those. So bleeding precautions, neutropenic precautions, dysphagia precautions, suicide precautions, all of that is already in here all day long. You had it at your discretion. Okay, so that's what's up. Now, you see that you have this is the hard one, y'all. Physiological adaptation. God help us. So if I take any system up here, right? I take cardio, respiratory, renal, acid-base, diabetes, endocrine, GI, immunology, cancer, neuro, ortho, burns, infectious disease, maternity, psych, geriatrics, and peds. If I take any of this stuff and I say to you these questions, this is where we get confused as students. We have to be very, very careful because you confuse all of these together. And I'm going to give them to you because I really want you to know every time you do questions now, say to yourself, did I stop and think about pathophys before I answered that question? So watch this. So let's look at this. Let's say that, which disease do I want to give y'all? Let's say breast cancer. It's a very, very, very common disorder. It's one that all of us could appreciate. Let's say as we're looking to figure out what the fuck does physiological adaptation mean, we're going to do breast cancer, right? Now, what causes breast cancer? Well, there's no direct cause, but of course, something has to be a carcinogen. So in this case, and you don't need to go crazy with this, I'm going to say in breast cancer's case, a type of carcinogen for breast cancer, and look at the word, because this is the thing I teach you the most. These 3 days we're going to be loving on each other. I say if it ends in gen, it generates whatever is at the beginning. Carcino means cancer, okay? So what is it with breast cancer? What generates breast cancer or causes breast cancer? Carcinogen, what causes cancer? In breast cancer, you can't say it's a cause. You can only say it contributes to the cause. So this word is very, very suspect. And most of the time, it's unknown directly. However, there are some diseases that I can point to a cause immediately. Let's examine. If I chose, instead of breast cancer, I said lung cancer, what would you say is a cause? You see how easy that was? We can't say that for breast cancer because it's too many different things. However, there is one carcinogen, and smoking you might think is it. It's actually alcohol. Okay? All right, now let's do signs and symptoms, which is very different from causes. And these two get confused all the time, like you did with the ascites. You said ascites was fluid volume overload. That was a sign or symptom. It was not a cause. Does that help? Okay, let's do this. If I say sign and symptom, typical breast cancer, I could say, oh, painless, usually doesn't hurt. I could say unilateral, usually not in both breasts, just one. I could say hard mass. I could say immobile, I can't move it. I could say irregular border. It's all signs and symptoms. Does that help? Okay, now let's say risk factors. This is more likely to be related to the causes. This and this are very related. Because if smoking is a cause of lung cancer, isn't smoking a risk factor for it? So they're kind of related. But yet, listen to me clearly, there are distinct features of both. So I'll give you an example. If I say, what's a risk factor for C. diff, and you say elderly, you are right. Did elderly cause C. diff? See how they only overlap so much? You can't just be confused. Now, when it comes to risk factors for breast cancer, well, there's a ton. Alcohol is also a risk factor. Smoking then would also be a risk factor. Not a direct related cause like alcohol, but it is a risk factor. Having no children ever is a risk factor. Y'all still with me? Being a person who is obese is a risk factor. Are you with me? Estrogen is a risk factor. Y'all still good? Okay. Now, depending on the biopsy, estrogen might have been the cause. It depends on the biopsy. How many of you have heard estrogen receptor positive? Like you kind of heard that. Then indeed, estrogen was the cause. Sometimes you don't know that till you do the biopsy. But what my point is, beloved, when we say physiological adaptation, this is that. This whole list of crap on every disease process is that. So you got that. Now let's say complications, shall we? We'll say complications, huh? Well, complications. Death. You can die from breast cancer. You know that already. Because what? It could spread all over, right? So metastasis means it could spread all over, right? Okay, you could have complications from the treatments too, like the chemo, the radiation, the surgery. Any of those could have the complications. You just kind of got to know that. Okay, what about the treatment? Well, we always start with any cancer looking at surgery, and then we look at chemo, and then we look at radiation, and kind of go with that. Sometimes it's genetic stem cells. It could be anything, but that's part of physiological adaptation. Prevention, oh, well, then we need our mammogram here. Self-breast exams. You shouldn't really be drinking unless you're celebrating something big. You fucking drink every night, you're gonna fucking get breast cancer. It's kind of simple, okay? So it's kind of simple, all right? Now, background. That part you don't necessarily mess up on, you kind of feel good about. Here's background. It's common. In fact, it's the second cancer of women. First, of course, in the whole country is lung, right? But then breast is the second killer for women in cancers. Prostate is the second killer for men, right, guys? You know this. I'm not telling you anything you don't know. Colon cancer is third. So first is always lung, breast for female, prostate for male, and colon is always third. Okay, so that's the background. All right, black women die more, but white women are diagnosed more. So it's kind of like background. Okay, what else about breast cancer? Oh, it can recur. It can come back. It can attack the other breast. It's a risk factor for another cancer, right? I mean, you know, background. So physiological adaptation, when I see a student does not do well in that, I'm extremely concerned because it is the least likely to fail. Because what did I say your school did? Concentrated on this. So it's least likely to be failed. So when you do fail it, I'm like, oh, we might need to take a little bit more time with you. You might need a little bit more work because it sounds like your school never covered the basics of disease process when I see that you failed in physiologic adaptation. And frankly, I see this in Florida the most because Florida has the worst schools. They have the highest failure rate on NCLEX. And you already know the shady shit that went down. Some of the stuff my students tell me from Florida make me want to cry for them. The one told, well, more than one actually, this school, Carlina, I think it was called, I don't remember. But anyway, they told me the school would only accept cash. You should probably be concerned if a school only accepts cash. And they had a storefront. So if you go, let's say that you live in Cleveland and you went over there to Sam's Club and you saw Ollie's storefront, Ollie's. This was the school, and then they disappeared overnight. Swear to God, they disappeared overnight. So yeah, you should be concerned if you did fail this because it means you didn't get the basics, and that's all right, baby. But you're going to look at almost all them damn videos I got in there. Somebody who got the basics don't need every fucking video. They need a lot of them, but they don't need 700. Good God. Okay, they need a lot. They need enough to get an 85, or they need enough to get a 75. And once you get it, you're done. Move on to the next subject, for crying out loud. Okay.